Are we ready to start, Caroline?
Yep, we're all set.
Okay. Seeing who's coming in. We've got some more participants coming in. I'm just going to let the room fill up a little bit before we get started. So folks, we will get started in a minute or so. We're just, a lot of people are joining this webinar, so we're giving some space as they all join in. It takes a while we have a very large number of people registered. Okay. I see that people are still joining, but it's slowing down a little bit. So why don't we get started? Thank you for joining us today for this webinar, What Congress' Latest Healthcare Cuts Mean for Pennsylvania. My name is Amy Lowenstein. I'm from the Pennsylvania Health Law Project, and I'm pleased to be joined here today by Joanna Rosenheim from the Pennsylvania Health Access Network and Mary Pat Pileggi from Community Legal Services. A few housekeeping things. This webinar is being recorded. A copy of the recording and the slides used in this presentation will be shared after the recording. Closed captioning is available for this webinar. To enable closed captioning, click the three dots at the bottom of your Zoom control panel and then click CC Live Transcript and Show Captions. You can also hide captions by clicking Hide Captions. If you have questions, please put them in the Q&A. We will answer some questions in the Q&A box and others at the end of the webinar if we have time. We will attempt to get to as many questions as we can, but we may not be able to answer them all. We will also be dropping resources throughout through the chat throughout the webinar. If you want to check the chat feature, you can find resources there. And again, we will share the slides after the webinar. Following this webinar, we will send out a survey to participants so you can provide feedback, and that link will be added to the chat at the close of the webinar as well. Next slide. So today we are going to provide a little background on why we're here, why we're talking about federal changes to healthcare access. And then we're going to cover three main topics. We're going to talk about Medicaid and the provisions in the latest congressional reconciliation law that made changes to Medicaid. Then Joanne is going to talk about Penny, which is Pennsylvania's healthcare marketplace and the impact of changes on that marketplace. And then we're going to talk about immigrant access, and that's where Mary Pat's going to take over. And then we have some resources and some steps you can take going forward. And then we will take questions after that. Next slide, please. Okay. I want to preface this by saying this webinar has a lot of unfortunate news. So there is a lot to share here about what's happened with this new law that passed in Congress. Please stay on to the end because we do have resources and there are some things where folks can still take some action. But let me provide a little background on what happened and how we got where we are today and why we're presenting this webinar. So in July, Congress passed House Resolution 1, or HR 1. It's a law that is sometimes called the Budget Reconciliation Act, or OBA, or One Big Beautiful Bill Act, but we will be calling it HR 1. It was passed almost entirely along party lines, and it only required a simple majority in Congress because of a special procedure that was used called budget reconciliation. It was signed into law by the president on July 4th, 2025. And what this law does is it really represents, among other things, the largest cuts to healthcare in history in the United States. It cuts more than $1 trillion from healthcare programs over the next 10 years, and it leaves states to fill the gaps in that coverage loss. The target of the healthcare cuts are really a few things. There's a target on states like Pennsylvania that expanded Medicaid under the Affordable Care Act to ensure that low-income people could access health insurance. It also targets access and eligibility for Affordable Care Act programs like Penny, which is what Joanna is going to talk about. And it targets immigrants and immigrants' ability to access healthcare programs. Overall, it will have a devastating impact on healthcare access and affordability across the nation and right here in the Commonwealth. On top of HR 1, there are some new federal rules that limit who can get coverage under the Affordable Care Act and Penny and make it harder for everyone to apply for and keep ACA coverage. And we have some premium tax credits that we're helping people afford Penny that are still not reauthorized. And so those two things are also going to be covered by Joanna. Next slide. So I'm going to focus in on Medicaid changes that are ahead. I want to say right off the bat that nothing today Today, there is nothing that is changing about eligibility enrollment. So if you hear from somebody who says, I shouldn't apply for Medicaid because I hear there were cuts, that is not true yet. The cuts to Medicaid are not here yet. The first cuts that we're going to see, and I have a timeline, will be in October 2026. So there's nothing that has changed yet. People should still apply if they think they're eligible and renew and always renew even if you're not sure if you're eligible, because that can help you, you know, keep your access to Medicaid or maybe get transferred to Penny for more coverage. Next slide. Okay, I want to give a little background on Medicaid and who it covers and how it's funded, because that's important to understand why I talk about the impact of these federal cuts on the state. So Medicaid is public health insurance for people with limited incomes. And it's a federal state partnership. So it's a partnership between Pennsylvania in this case and the federal government. And what that means is the federal government pays a portion of Medicaid, and Pennsylvania pays a portion. In in Pennsylvania, we have what's called a federal match or an FMAP. And this year, the FMAP is 56% of Medicaid is paid for by the federal government, and 44% is paid for by Pennsylvania. So a sort of simple way to think about this is if somebody goes to a doctor and the doctor bills Medicaid $100 for that treatment, $56 of that will be paid for by the federal government, and 44% will be paid for by the state of Pennsylvania. So you can see the Pennsylvania really relies heavily on federal funds. In reality, the federal government actually pays more than 56% because there are some categories of Medicaid where they pay 90% when someone goes to the doctor. So we are really looking at a lot of funding that we rely on from the federal government to keep this program going. And throughout these slides, I use the term Medicaid or medical assistance or MA, and you'll hear Mary Pat use those terms as well. So those are all the same thing: Medicaid, medical assistance, MA. Next slide, please. Okay, so there are 3 million Pennsylvanians who are on Medicaid. Next slide. That is actually nearly 1 in 4 of all people in the state of Pennsylvania. And it's even higher for children. 39% of children are on Medicaid in Pennsylvania. We also help people with disabilities on our Medicaid program, and 192,000 or more people rely on Medicaid to stay out of institutions like nursing facilities. At the same time, nursing facilities, residents who are in nursing facilities are almost all covered by Medicaid. 59% of people in nursing facilities are covered by Medicaid. And then we have the population of people who are in an expansion category of Medicaid. This is what I talked about earlier when I said the HR1 targets the expansion of Medicaid. So that is adults who are 19 to 64 who were previously not eligible for Medicaid. So maybe they didn't have a disability or they weren't pregnant. So back in when we expanded Medicaid in Pennsylvania in 2015, adults age 19 to 64 who were very low income were able to access Medicaid for the first time. In Pennsylvania, that represents about 750,000 Medicaid recipients. And next slide, please. So I'm going to talk a little bit about the impact of this bill and just the impact of the Medicaid provisions, although some of the ACA provisions feed into these impacts. So these are the largest cuts to Medicaid that have been seen in the program since it began 60 years ago. We're looking at $990 billion cut to the Medicaid programs across the country, including Pennsylvania's Medicaid program, over the next 10 years. The Pennsylvania Department of Human Services estimates that this is going to mean at least 310,000 Pennsylvanians will lose Medicaid. This number doesn't include all the people who would be applying for the first time, who may no longer be eligible. And we also have to consider that there are people whose coverage may be lost due to challenges they have with paperwork and processing delays. And you think, well, why would people who are, other people be cut just because of paperwork issues? We expect this new law to really increase the burden on both people who are trying to keep Medicaid, applying for Medicaid, and on the eligibility workers who are trying to help them. There's going to be a lot more paperwork, shorter timeframes to make, for renewals. And this is going to really impact people's abilities to keep up with renewals and likely result in more errors and missed paperwork. What this means is more people will lose insurance. And when people lose insurance, they have more medical debt. And when people have more medical debt, that also means that providers aren't getting compensated for the care they're providing, like hospitals, which can lead to hospitals having less income. There could be closures, particularly in rural areas. We already have challenges keeping hospitals in rural areas open. And providers are going to see lower reimbursement rates because there's not enough money in the Medicaid program. We've already heard that some of the Medicaid health plans are cutting reimbursement rates in anticipation of these cuts to certain providers. So overall, we're looking at potential cuts to funding to the Pennsylvania Medicaid program. And this could lead to changes in eligibility and services that the Medicaid programs cover. Next slide, please. Okay, so let's talk about the time frame for everything. So I put there's a lot in here in this bill, this HR1, this new law that covers Medicaid. We are not going to cover everything that the bill does. We're going to talk about some key issues. So the first thing that's going to happen in October 2026 is there's going to be a change to immigrant access to Medicaid. That is what Mary Pat's going to go into much more detail about. Most of the larger cuts start in January 2027 with new work requirements, more frequent renewals, changes to whether you can get coverage retroactively. That'll start January 2027. And then later in the year, there's going to be changes to how Pennsylvania can fund its Medicaid program with provider taxes. And then in the next year, there's going to be changes to how much money Pennsylvania can direct to providers who may be struggling to stay afloat, especially in light of these changes. So I'll go into more detail about that. Next slide, please. Okay. So I'm going to talk about the work requirements. This has gotten the most attention and well-deserved attention because it's a very new requirement. It's not something that has been previously required in the Medicaid program. Um, so we don't, I want to just tell you, I'm going to tell you what we know about the work requirements, but there are some things where we're waiting to hear from the federal government about how certain exemptions will be defined, and some other sort of nuances about this. So we don't know everything. We'll do our best to answer questions and provide information, but we will provide updates as we learn them as implementation of these work requirements goes forward. So I want to emphasize something right now off the bat. The work requirements apply to people who are in the expansion of Medicaid category. And I'll explain who that really is. But I want to be clear that this does not apply. I'm going to use some Medicaid terminology, but if you're in these categories, you know who you are. It does not apply to people who are on a Medicaid waiver. It does not apply to people in the Community Health Choices programs. It does not apply to people on medical assistance for workers with disabilities, which is often called MAUD, and it does not apply to young people under 19. So really, and there's other categories of Medicaid too, this only applies to people on Medicaid expansion. That is a lot of people, but it's not everybody. So I just want to make that clear. Um, so The expansion category is adults ages 19 to 64 who were not eligible for Medicaid in any other category and who are not pregnant and who are not receiving or eligible for Medicare. And what this new law requires is that people in that category who don't, people who are not on Medicare, not pregnant, have to meet a community engagement requirement. And there are several ways that this can be met. First, they can work 80 hours a month or do community service for 80 hours a month or be engaged in a work program for 80 hours a month. Um, or they can attend educational or career training program at least half time. Also, they could do a combination of those things. So there could be some community service, maybe a work program, and some part-time work. That will be enough to meet the requirements. There also is a possibility to meet it if you have monthly income that's equal to at least the federal minimum wage, which is $7.25 an hour, times 80 hours, which is a total of $580 a month. And similarly, if someone's a seasonal worker, let's say somebody who drives a school bus during the school year, but doesn't work in the summers, they will be able to average their income over the prior 6 months to become eligible, even if they may not be working right away at the time they apply. So those are the ways that these work requirements can be met. Um, I want to just say something about the monthly income being equal to or less than the federal minimum wage. We have to learn more about how income is defined here. It's not necessarily just employment income, so more to come on that probably in future months. Next slide, please. Okay, so how do people comply with this work requirement? First of all, it's a pretty draconian requirement. It doesn't, a person can't sort of apply for Medicaid and then start working after they've been found eligible. They have to have already met this work requirement at application. So in 1 to 3 of the months immediately prior to application. And the number of months that's going to be required is up to the state. So 1 month would be ideal if somebody only needed to meet 1 month of work requirement to become eligible. But states have the option of requiring up to 3 months. And then if once someone's on Medicaid, they still need to meet this work requirement. They have to show that they've met it at least once between the last time they were found eligible for Medicaid and the renewal. So the number of compliance months that the person has to meet between the eligibility and the renewal, that is also up to the state, but it has to be at least 1 month. And then the consequences of noncompliance are not just being ineligible for Medicaid, but also the person is then barred from getting help paying for coverage on Pennsylvania's marketplace or health insurance marketplace called Penny. They can pay full price for Penny, which would be very challenging if somebody is low income, but they are not going to be allowed to get subsidies. Next slide, please. Okay. So if we're going to have this requirement, the really important thing is that we have exemptions. And thankfully, there are some. There are not a lot. These are the main exemptions that are available. And I want to emphasize that even if somebody meets an exemption, they're still going to have to have some way of demonstrating that they meet that exemption. We have work to do to figure out how this is going to be documented, whether there are ways that the Department of Human Services will be able to figure out if someone's exempt without having to, get them to prove it. There might be ways that they can document it, getting information from sources that are available without having to get all of this information directly from the participant. But there will be people who are going to have to show that they're exempt. And we don't know how often that's going to have to happen. But just like proving that you're working, you're also going to have to be able to show that you're exempt. So one of the major exemptions is a parent, guardian, or a caregiver of a child under 14, so 13 or younger, or if the person's taking care of a person with a disability. Another category is someone who's pregnant, which we already said was exempt, or in the Medicaid postpartum coverage period. So if somebody was pregnant and on Medicaid, no matter what the reason that the pregnancy ended, they are entitled to a year of postpartum coverage. And also during that time, they are exempt from the work requirements. Then a big category, and a category that really needs more fleshing out, is medically frail. I put that in quotes because that's what it says in the law, or having special medical needs. So this includes people who are on Social Security disability but may not yet be on Medicare. So if they meet that definition of having a disability under Social Security law, somebody with a serious or complex medical condition that impairs their ability to do at least one activity of daily living, such as, those are daily living tasks that help you care for yourself. They also say, and I'm putting this in air quotes, disabling mental disorder or a substance use disorder. So those are some of the categories that come into medically frail or special medical needs. And we are waiting for more guidance on that from CMS, which is the federal agency that oversees the Medicaid program. That guidance is supposed to be available by June of 2026. But you saw earlier that January 2027 is when this is supposed to start. So that's not a lot of lead time for states to figure out who's exempt. There's a few other categories: veterans rated with a total disability, people who are previously incarcerated, but only if it was within the prior 3 months, which is not a lot of time to get on your feet after incarceration, former foster youth up to age 26, and someone who's compliant with TANF or SNAP work requirements. This, I want to say, is not, SNAP is the Supplemental Nutrition Assistance Program. Excuse me. So SNAP also has work requirements and it has exemptions from work requirements. I want to be careful to say that just because someone's exempt from a SNAP work requirement does not mean they are exempt from the Medicaid work requirements. For example, in Pennsylvania, somebody who's homeless is exempt from the SNAP work requirements. There is nothing in this law under HR 1 that exempts people are homeless from the Medicaid work requirement. There may be other ways that somebody in that who is homeless or unhoused can meet an exemption, but just because they're exempt from SNAP isn't going to be enough. Next slide, please. Okay, so the Department of Human Services estimates that 200,000 people approximately who are already on Medicaid will lose Medicaid. That's 27% of the expansion population just from these work coverage requirements. And many of those people, probably most of those people, will actually be eligible. Either they're meeting the work requirements or they'll be caught up in the red tape of trying to prove that they have an exemption or that they are actually meeting the requirements. So we're not expecting people to lose coverage just because they're not complying. We're expecting most people to lose coverage because there's too much red tape that they're going to have to go through. Pennsylvania has some options to try to help reduce the harm from the work requirements, and that is to require only 1 month of compliance at application or renewal, minimizing compliance checks. There's some hardship events that they can add, like if someone's in the hospital, exempting them, natural disasters. We really want to encourage Pennsylvania to use more external data sources of information, so that they don't have to ask a participant to prove everything, that they can find out if someone's exempt on their own or meeting a requirement. And we want them to align where possible with SNAP. Next slide, please. Okay, so another big change, and I'm gonna go through some of these other changes a little more quickly, just so that everybody has time. Um, Are semi-annual renewals. This again applies only to the expansion category of Medicaid, but it applies to everybody this time. There's no exemption for people who are pregnant. They have to undergo a renewal every 6 months. Right now, it's every 12 months. So it's going to be changed to every 6 months, and there's an estimated 110,000 people who are going to lose Medicaid because of challenges complying with that more frequent renewal requirement. This really increases the burden on eligibility workers. And because the eligibility workers are going to have to do twice as much work for this population, we are expecting it'll impact all Medicaid recipients because everybody's has renewals. So if there's a backlog, if there's documents that are being delayed and being processed at the county assistance offices, that's going to affect anybody who's renewing their Medicaid. Next slide. Thanks. Okay. And then regarding eligibility, right now, if somebody has a catastrophic health event or something happens in their lives and they need Medicaid, but they delayed in enrolling, let's say somebody had a stroke at the end of a month and it takes them a couple months while they're trying to recover to apply for Medicaid. Right now, they can get retroactive Medicaid for 3 months before the month they applied. So that means they can get coverage for major hospital bills that they face, if they would have otherwise been eligible. What this new law does is it reduces that. So 3 months retroactive is no longer available. It's going to be only 1 month retroactive for people who are in the Medicaid expansion category. It's people 19 to 64 who are in other categories, and 2 months for everybody else. And that includes people at nursing facilities who often have challenges getting their applications together, because they're in a nursing facility, they don't actually have access to all the documentation they need. This is really going to hurt people and it's going to hurt institutions that need coverage for the care they provided. It's especially going to be problematic for people who have sudden health crises. Next slide. All right, so the next two slides are a little bit, I'm going to admit, wonky, but this is really where Pennsylvania gets hurt, in terms of feeling the cuts directly. So it's not, this is not about eligibility and enrollment per se, but it's about changing how much money Pennsylvania can have. So we in Pennsylvania use what are called provider taxes. Those are taxes on large providers like managed care plans and hospitals and nursing facilities. And we use those taxes to help fund the state's share of Medicaid and to help direct payments to providers who are struggling, who might need more money, or where, where there are lower reimbursement rates already. So provider taxes are really important. The new law says no new or increased provider taxes anymore, that we can't help fund our Medicaid program this way anymore. It also caps the existing provider taxes and reduces them down to 3.5% of what the providers make from 3.5% of the revenue from patient care. This, and we do have some provider taxes that are up in the over 5%. The cap was always six before, 6%, but this really does reduce how much money Pennsylvania is going to have to be able to support the program. It also changes state directed payments. So state directed payments are payments that Pennsylvania Department of Human Services says that Medicaid managed care plans have to provide to providers. So they might say, you need to provide this certain extra amount of money to hospitals that serve children or hospitals in general to help support those institutions and to ensure those institutions will want to take Medicaid participants because Medicaid tends to pay lower rates generally. So right now, the state can tell a managed care plan that they need to pay up to the amount someone's commercial insurance might pay, and commercial insurance always pays more to providers. The new law is going to cap that at the Medicare rate. That is the rate that the Medicare program pays, which is much lower than commercial. It applies to hospital services, inpatient and outpatient, nursing facility services, and academic medical center services. So University of Pittsburgh Medical Center, here we have University of Pennsylvania. They're not going to get as much reimbursement. There's also talk, and there was some guidance and the suggestion that the federal government wants to extend this limit on how much providers can get paid through these state-directed payments to other types of providers, and that's important. Pennsylvania pays, or has in the past, required plans to pay more to nursing agencies that serve children in their homes. So we wouldn't want to see that affected either. But right now, we're looking at hospital services and academic medical centers and nursing homes. Next slide, please. Okay, so the impact of this combined, if you look at making it harder for us to raise revenue and limiting how we can direct payments in Pennsylvania, we're looking at least $20 billion in lost revenue for Pennsylvania over 10 years. That's $2 billion a year. This is an estimate coming out of the Department of Human Services. This means less money to support Medicaid programs and the healthcare infrastructure. So hospitals and providers, lower provider taxes. They're going to get paid less by the Medicaid program. When a provider gets paid less, they don't want to work with the Medicaid program and the Medicaid population. And we don't know what Pennsylvania is going to do. Backfilling this is going to be really challenging without, doing things like raising taxes. Um, or really anything could be up for consideration. So there are Medicaid services and eligibility groups that are optional under Medicaid. So we could see wait lists for certain Medicaid programs, or we could see changes to required benefits, to optional benefits like prescription drugs. So we really don't know where this is going, but that is an area that we are extremely focused on, and Pennsylvania has some terrible choices ahead. Next slide. Okay, I'm gonna close out now, and I'm going to have Joanna take over, but I want to just remind everybody before we leave this Medicaid section that what I said at the beginning. Medicaid is still available today. Nothing is changing yet. Please, please keep applying, keep renewing, keep your Medicaid going, and we'll have some resources at the end. Oh, I'm sorry, I did have some takeaways. I apologize. I forgot. I had some takeaway and action steps. I forgot. You should keep your contact information up to date with the county assistance office. This way you will get renewals and also information about any changes that happen. Renewals come in a pink envelope. Look out for that pink envelope. It's very big. It's light pink. It's not hot pink. Open your mail and compass messages. If you feel like you have trouble with notices and getting information, have a representative who can also get copies of your notices. And you can stay engaged on any updates to Medicaid with PHLP. When you get the slides, there'll be a link to sign up for our newsletter and alerts. Thank you.
Thanks, Amy. So my name is Joanna Rosenheim. I'm with FAN, the Pennsylvania Health Access Network, and we're going to be switching gears a little bit to talk about Penny, which is Pennsylvania's health insurance marketplace. So right now, we're not going to be talking about Medicaid. We're going to switch over to what changes are going to be happening to Penny. Next slide, please. So Penny is Pennsylvania's health insurance marketplace. Federally, it's known as Obamacare or the marketplace, but here in Pennsylvania, we have our own state-based exchange and it's called Penny. So Penny is available for people who are not offered employer coverage or for people who don't have Medicaid or Medicare. And it allows folks to purchase health coverage through Penny with tax credits to help lower the costs. Currently in Pennsylvania, we have nearly 500,000 people enrolled in Penny, which is more now than ever before. And that's largely thanks to the increased tax credits that we have, which we'll talk a little bit more about later. But enrollment has really soared because of these enhanced tax credits that were passed in 2021. Next slide, please. So most people enrolled in Penny do qualify for these tax credits. 9 out of 10 people qualify. Most without the tax credits, the full cost of plans through Penny would be prohibitively expensive. So the tax credits are really what make Penny plans affordable for people. And they have always existed with the marketplace and through Penny. But again, in 2021, there were enhanced tax credits passed that I'll talk a little bit more about later in more detail, but the enhanced tax credits have really made Penny plans more affordable than ever. Additionally, the tax credits help people with low incomes. So for people with incomes below around $23,000 a year, those folks can qualify for free plans through Penny for now. There will be some changes to that, but as of now, people with low incomes are eligible for free plans. Many Pennsylvanians, including small business owners, preschool teachers, students, gig workers, and early retirees, rely on Penny for affordable health coverage. And it's really the only option for affordable health coverage for folks who are not offered any insurance through their employer and are above that income limit to qualify for Medicaid. Next slide, please. So there are three main drivers of change that will impact access to Penny coverage over the next few years. First, a new law that was passed by Congress in July, which, as Amy mentioned, is referred to as HR 1 or the Budget Reconciliation Bill. That bill includes various changes to healthcare programs. So it includes changes to Medicaid and Medicare, as well as changes to the marketplace, again called Penny here in Pennsylvania. And that bill will impact access to affordable health coverage through Penny. Additionally, enhanced tax credits that help lower monthly costs through Penny are set to expire at the end of this year. We'll discuss this in more detail later, but if these enhanced tax credits are lost, that's going to impact people's ability to afford affordable health coverage through Penny. And then lastly, CMS, the Center for Medicare and Medicaid Services, also imposed strict new rules that will make it harder to enroll in Penny. It includes prohibitions on gender affirming care from being offered as an essential health benefit and makes DACA recipients ineligible for health coverage through Penny. And we'll discuss a few of these in more detail. Next slide, please. So there are a lot of changes that are going to be happening to the marketplace. We're not going to be discussing each and every one of these changes in detail today, but they can generally be broken down into three main categories. So first, as a result of the changes, there will be more barriers in general to the application process for Penny. So there are a lot of different changes that are going to take place over the next couple of years that will create more barriers to the application process and just generally make it harder for people to access health coverage through Penny. Additionally, and Mary Pat will discuss more of this later, but certain immigrants are going to lose access to affordable health coverage through Penny. And then lastly, as I mentioned already, premiums are expected to significantly increase if Congress doesn't take action to extend enhanced tax credits by the end of this year, by December 31st. Next slide, please. Okay, so some of the changes that have happened, some of the federal changes have already taken effect. So as of August, there are a few different things that have already taken place. Firstly, last November, DACA recipients, Deferred Action for Childhood Arrivals, were granted eligibility for marketplace coverage for the first time ever. So prior to last November, DACA recipients were not eligible for affordable health coverage through the marketplace. The new rule imposed by CMS removes that eligibility for DACA recipients. So as of August of this year, DACA recipients are no longer eligible for health coverage through Penny. And then since 2022, people with low income, so people with income below 150% of the federal poverty level, which is around 23,000 for a household of one, were able to enroll in Penny coverage year round. So typically there's a very strict deadline to enroll in Penny, and you have to enroll in coverage during the open enrollment period, which is from November 1st to January 15th. And outside of this window, most people are not eligible to enroll unless they have certain life changes. For example, losing health coverage from a job is a very common life change. Uh, and, other than that, you were not able to enroll in Penny, either through the open enrollment period or through having a special enrollment period. But there was a year-round enrollment window for people with low incomes to apply for Penny coverage year-round, and this was really a safeguard for folks who had low income but were slightly above the eligibility limit to qualify for Medicaid. So as of August, that year-round enrollment window for people with lower incomes has been eliminated, and folks will have to apply for coverage through Penny during the open enrollment period starting November 1st. And then additionally, as a result of the CMS rule, applicants will only have 90 days to submit documents to Penny to confirm their income. So if documents are not received and approved by Penny within a 90-day window, then tax credits can be removed, which will result in people being responsible for the full cost of their Penny plan. So it just shortens that window for people to submit documentation to confirm their income. Next slide, please. All right, so as I mentioned, we're not going to discuss each and every change that is going to happen as a result of these federal laws and rules. But I have here a list of some of the most important changes that will take effect between January 2026 and January 2028. For a more detailed look at these changes and when each change will take effect, we've linked a resource from our national partners, the Center on Budget and Policy Priorities. So you can take a look at that link for a more detailed timeline of the changes and what each change is, including some that aren't listed here. And then we also have a timeline of all of these changes on our website at pahealthaccess.org. So you can check out both of those places for a more detailed list. But here we have just some of the most crucial changes that are going to happen over the next couple of years. The first one is increased paperwork requirements. This one does sort of have a caveat because there is a lawsuit pending that has put some of these paperwork requirements on pause. Um, if the lawsuit fails, I don't know if that's the right terminology, but if the lawsuit fails, then the rules will take effect. And if they do take effect, it will mean that in general, penny applicants will have to provide more documentation to prove their income than ever before. And they'll also have to provide documentation to prove eligibility for a special enrollment period. So that special enrollment period is what allow people to apply for penny outside of the open enrollment period during November to January 15th. So if folks have special circumstances, if they have a life change, like losing health coverage through a job or moving to Pennsylvania from another state, then they can get a special enrollment period and they're able to apply for penny coverage outside the open enrollment window. Currently, penny applicants don't have to provide proof to open up one of these special enrollment periods in most cases, particularly for the loss of coverage through a job. Right now, people don't have to submit proof that they've lost health coverage through a job to open up that special enrollment period. However, if this lawsuit fails, then people will need to submit more paperwork to prove both that they qualify for a special enrollment period and also there will be more rigorous documentation requirements to prove income. And then second on this list, so not this year, but for plan year 2028, Penny will no longer be allowed to automatically renew coverage for people, and people will have to take action on their own to submit an application every year. So this is sort of a change from what currently happens, which is that Penny, if a customer already exists through Penny and has purchased a plan in the past and has given Penny consent to do so, they can automatically renew coverage, resubmit an application automatically, and then re-enroll in the plan for the next year during the open enrollment period. So this really eases the burden on people. It makes it so that people don't have to submit their application every year and go through that sort of rigorous process. But moving forward, so for plan year 2028, that will no longer be allowed and people will have to take action on their own to resubmit their application for health coverage every year. And then additionally, for plan year 2027, so not this open enrollment, for plan year 2027, so that's next open enrollment, the open enrollment period will be shortened by 2 weeks. It will end on December 31st rather than January 15th. So as of now, the open enrollment period starts November 1st and ends January 15th. But for plan year 2027, it's going to be shortened by 2 weeks. This is an issue for obvious reasons, but that extra 2 weeks is really helpful for folks who are busy during the holidays, who need extra time to gather all of their income documentation, et cetera. So we do expect that the short and open enrollment window will result in fewer enrollments in penny coverage. And then again, Mary Pat from CLS will discuss this in more detail later on, but starting January 1st, 2027, certain immigrants who were previously eligible for tax credits through Penny, always historically eligible for tax credits. This includes asylees, refugees, victims of domestic violence, and so on, will no longer be eligible for tax credits. So certain immigrants who have always historically been able to get affordable health coverage through Penny will no longer be able to receive the tax credits. They can purchase coverage at full cost, but that is very prohibitive for most people. And then additionally, when Medicaid work requirements take effect, uh, as we discussed earlier, there will be Medicaid work requirements. People who are found ineligible for Medicaid because they didn't meet a work requirement will not be eligible for tax credits through Penny. So this really affects a subset of people with incomes between 100 and 138% of the federal poverty level. This year, that's around 16,000 to 22,000 for a household of one. These people, if they're found ineligible for Medicaid because they don't meet a work requirement, they'll have essentially a coverage gap and they won't be able to get Medicaid because they won't meet if they haven't met the work requirement. and they won't be able to purchase affordable health coverage through Penny. They won't be able to get those tax credits that are what make Penny coverage affordable for people. So there's going to be a coverage gap for those people between 100 to 138% of federal poverty. Additionally, there's currently a cap based on income on how much people have to pay back in tax credits if they underreport their income on a Penny application. So if you apply for Penny and you end up making more than what you reported on your application in a year, there's a cap on how much you owe back during tax time. But this cap will be eliminated for plan year 2026, and people have to owe back the full amount of tax credit if income is not reported accurately on the Penny application. So these are some of the most important changes that are going to happen between 2026 and 2028. Again, for a more in-depth list of all of the changes and when they'll take effect, you could take a look at the resource here from CBPP, as well as our website, pahealthaccess.org. Next slide, please. Okay, so I've mentioned the enhanced tax credits a couple of times, but just to give a brief overview, uh, most penny enrollees receive financial assistance in the form of a tax credit that helps lower the monthly cost for penny plans. These tax credits are applied to plan premiums immediately, so people don't wait until tax time to receive the credit. They're directly applied to the plan premium on a monthly basis for people. The tax credits have always existed through the marketplace, through Penny, but in 2021, enhanced tax credits were implemented that made health coverage through Penny, through the marketplaces nationally, more affordable than ever. These enhanced tax credits are set to expire at the end of the year unless Congress takes action to extend them. Congress is currently actively debating extending the tax credits, so there's still time and hope for these tax credits to be extended, but it's currently under debate. Next slide, please. All right, so just to give an overview of the impacts of losing the enhanced tax credits, without the enhanced tax credits that were implemented in 2021, we expect penny premiums to double or more for people. People with low incomes will no longer be eligible for those $0 monthly premium plans that they have been eligible for the last few years. And additionally, people with higher incomes, but income above 62,000 for a single person will no longer be eligible for financial help. Next slide, please. All right, so because of the enhanced tax credits, tax credits have roughly doubled since the enhanced credits were passed in 2021. So that cut premiums in half for Pennsylvanians. Most people are eligible, or more people are eligible for tax credits than ever before. And Penny enrollees really only know having coverage through Penny with these tax credits. So they're really going to feel the shock and the impact when and if they're notified about their premiums increasing by double or more, because they've only known having coverage with these enhanced credits. As a result of the credits, we've seen enrollment in Penny and through the marketplaces nationally soar, and more people are enrolled now than ever before. Next slide, please. So just to give some scenarios of what this looks like in practice for families across Pennsylvania, we have a couple of examples. For a family of four in Philadelphia County with an annual income of around $78,000, their monthly premium is currently $260 a month with the enhanced tax credits. That is 4% of their annual income. But without the enhanced tax credits, their monthly premium would go up to $541 a month. That is 8% of their annual income. So if the enhanced tax credits are not extended, it would result in a 108% increase in this family's net premium. For another example, for a married couple who are 60 years old in York County with an annual income of $82,000, they currently pay $586 a month with the enhanced tax credits. Their premium would go up to close to $3,000 a month without the enhanced tax credits. That would be $35,000 a year just in premiums for a 60-year-old couple in York County making $82,000 a year. That's 44% of their annual income. Um, so without the enhanced tax credits, plans will simply be unaffordable. People will drop coverage. People will go uninsured completely or just drop down to plans that have higher deductibles and won't really meet people's needs if they have healthcare needs. Next slide, please. Okay, so as a result of all these collective changes that I've discussed today, we do expect that about half of Penny enrollees will lose coverage. That's, because of the potential loss of the enhanced tax credits as well as these other changes that I mentioned. Um, as uninsured rates rise, we from people losing coverage through Penny, Medicaid, as well as private insurance, because these changes that we're discussing today will also impact private insurance premiums. Hospitals will be strained by increased uncompensated care. People will be showing up to hospitals without health insurance, and they will most likely not be able to pay for the coverage that they're receiving, and hospitals will be really strained by this. Additionally, people will be at more risk of medical debt because they will go uninsured and they won't be able to afford their care. And we also expect that small businesses will suffer as premiums rise and people can't, um, they can't keep up with their businesses or hire employees if healthcare premiums keep going up. Next slide, please. So I know we've already discussed a lot today, and a lot of these changes are overwhelming, but we do have some action steps that people can take to prevent themselves, to help navigate, these complex changes. First of all, we want to encourage people to really plan ahead and be prepared to submit increased income verification for Penny. We encourage folks to keep detailed records of income, including tax, bookkeeping records, as well as pay stubs if you have them, and be prepared to submit those records and be prepared. They should be accurate. So it's just good to have as much income verification and documentation as possible. And then additionally, we encourage folks to, you have to resubmit your Penny application every year starting next year. So soon, Penny will not be able to automatically renew your application. It's very important that you log into your account or call the Penny call center or call FAN for assistance to make sure that your application is submitted during the open enrollment period. And then additionally, it will be very important to start updating your income and household information regularly if your circumstances change throughout the year. If you don't report changes to your household or income, then you could be stuck with very unfortunate tax penalties. So it will be really important to update your income and make sure your income that's reported on your Penny application is accurate. And then, as always, we encourage people to shop for plans during the open enrollment period. Plans change year to year, and if the enhanced tax credits are not extended, then costs will go up. So we just encourage folks to take a look at your options, especially this year, to see what's available. Additionally, FAN is here to help. We have our statewide helpline, so we can answer any questions that you have about any of these changes. And if you need assistance applying for Penny, especially during the open enrollment period, we have staff that can make appointments with you. We can help you with that process, to make sure that you stay covered or get covered for plan year 2026. Okay, and then lastly, if you're concerned about these increased Penny premiums that I've talked about today, and you have a Penny plan, please share your experience about how Penny is important to you and how increased costs would impact you. We have a link here that I'll share, in the chat and in the follow-up, that you can use to share your experience. You can record a quick video just to explain why Penny is important to you and how increased costs would impact you. Next slide, please. Okay. And then some action steps for stakeholders or partner organizations. I'll discuss this later on, so I might pass it off. But we have a coalition, FAN-CLS, PHLP, and others I'm sure on this call are engaged in our coalition to make sure these changes have the least harm on Pennsylvanians. So if you're interested in joining, you can email bill@pahealthaccess.org. You can also use the link that I shared on the last slide to encourage folks to share their experiences with Penny coverage. And we're also asking people to reach out directly to their members of Congress, encouraging them to extend the enhanced premium tax credits. And we will share a link where you can send that message later on. And I think that's it. Okay, I'll pass it off to Mary Pat.
Thanks, Joanna. Hi, everyone again. Mary Pat here from Community Legal Services. I have been seeing a lot of good questions come in through the Q&A box, so feel free to keep those questions coming as I keep talking. I am going to provide an overview of the ways in which HR 1 is cutting back on immigrant access to healthcare programs. I'm going to start with a brief overview of some of the more common immigration statuses that we see. And just as a preview to that, I mean, I know immigration status can be really hard to figure out. And it's hard for us to figure out as people who might be trying to help someone connect to healthcare. It's also really hard for people who are going through these immigration processes themselves to figure out. And it can be not only confusing, but really scary. So if you're working with people who are not US citizens and trying to figure out what healthcare options they might have, one of the first steps you're going to have to take is to figure out what their immigration status is. Keep in mind that it might be confusing and scary, and so you might need to give some context for this conversation with the person you're trying to help. Let them know why you're asking. And sometimes you might have to go all the way back to the beginning. How did you arrive? Was it by foot, by plane? What kind of documents did you submit as you came into the US? And it can be tough. If you're struggling with these kinds of questions, here's my email address on this slide. I am happy to try to help people figure it out to the best that I can. So email me. Next slide. So as I said, we're going to start with an overview of some kind of common immigration statuses, common terms that you might hear being used when you're learning about immigrant access to healthcare programs. And it's important just to have kind of a baseline understanding of what some of these terms mean, so you can figure out exactly what HR 1 has done to cut back on immigrant access to healthcare programs. So I'm going to start here with the term refugee. This term is used in a lot of different contexts. Within immigration law, it has a very specific meaning, and people who have an official refugee status, an official refugee designation, are people who have left their home countries because of fear for their own life or safety, some violence or persecution that the government of that country is either inflicting upon them or cannot protect them from. They leave their country and usually go through a whole lot of process outside of the United States before they are able to obtain this refugee designation. And they get that refugee designation before they arrive in the US. So once they finally get here from day one, they have this official refugee status in place. Once they have been in the US with that refugee status in place for 1 year, they can then become a lawful permanent resident. Asylees, the test for asylum is the same as the test for refugee status. The difference with people who have asylum is that they arrive in the US without that refugee designation already in place. They get here some other way, and then once they get here, they ask for that refugee designation. Once they get here, they apply for asylum, they submit an asylum application. If that application is accepted, then they then become an asylee. Just like refugees, once an asylee has had asylum status for 1 year, they are then eligible to become a lawful permanent resident. Next slide. Cuban Haitian entrant. Cuban Haitian entrants are nationals of Cuba or Haiti who either, one, were granted parole to enter the US. So they presented themselves at a US border, and the immigration official they encountered there permitted them to enter by granting them parole, permission to enter the US. And a Cuban Haitian entrant, once they are granted parole, they are a Cuban Haitian entrant. And they remain a Cuban Haitian entrant, even if that initial parole term expired, even if it expired years and years ago, they remain a Cuban Haitian entrant. Or maybe they didn't present themselves at a US border, but they are here and they have applied for asylum in the US. That person is a Cuban Haitian entrant. Or number three, last way that somebody can be a Cuban Haitian entrant is if they are in removal proceedings. So the government is trying to deport them. They put them in these deportation proceedings, but there is no final enforceable order of removal yet. So that is a pretty broad definition of Cuban Haitian entrant. So if you're working with somebody from Cuba or Haiti, there's a fairly good chance they're a Cuban Haitian entrant. And that is a really, really important piece of information to have, because as we'll hear more about in a few minutes, Cuban Haitian entrants have today and will continue to have, even after HR 1, the same access to healthcare programs as US citizens. So really important to identify Cuban Haitian entrants when you can. The next status listed here is VAWA, self-petitioner. VAWA is the Violence Against Women Act. And one of the things that VAWA does, it says that if you are eligible for a green card through a family relationship with a US citizen or a green card holder, and that family member becomes abusive to you, you can separate from that abusive family member and petition USCIS, federal immigration officials, to get your green card on your own. Right. So if you're married to a US citizen, you're eligible for a green card because you're married to that US citizen, but your spouse becomes abusive. You can separate from your abusive spouse, ask for permission to apply for the green card on your own without your abusive spouse's participation. Once you get that permission to do that process on your own, you become a VAWA, self-petitioner, at that point. Next slide. Withholding of removal. This is not a totally very common status, but there are folks out there with withholding of removal. The test for this status is the same, almost the same as the test for refugee and asylum, but this particular status comes with fewer protections than asylum status. One of the ways that withholding of removal is not as beneficial as asylum is that you can't get a green card. You're not eligible for lawful permanent residency if you have withholding of removal. Parolee, I mentioned this term already when talking about Cuban Haitian entrants, but people from other countries can also be paroled into the US, and they are. So if you're paroled into the US, you're permitted to enter, usually for a specific amount of time and for a specific purpose. So for example, if you are at a US border and you say that you need to apply for asylum, you might be paroled into the US, allowed to enter the US for a few months in order to get that asylum application submitted. Temporary protected status, sometimes shortened to TPS. Every once in a while, the Department of Homeland Security will designate some country as too dangerous to deport people back to. If there's some crisis, it could be a political crisis, it could be a natural disaster. If the Department of Homeland Security makes that designation for that country, if you are in the US and you are from that country, you can get a TPS, a temporary protected status, immigration status for yourself, which protects you from deportation and allows you to be here lawfully and to get work authorization with that TPS immigration status. Finally, U visas. These are visas available to victims of certain crimes in the United States. These folks are eligible for lawful permanent residency after 3 years. And then last, but certainly not least, on the next slide, please. Next slide. There you go. So lawful permanent resident. I've mentioned this a couple times. This is green card. These are green card holders. This is if you want to become a U.S. citizen in the United States, you need to get this status first. This is the pathway to U.S. citizenship. These are non-citizens who have been granted authorization to live and work in the United States on a permanent basis. You can be eligible for LPR status through a number of different ways, through family relationships, but also through some other immigration status that you had first, right? So, for example, refugees, asylees, people with T visas who are victims of human trafficking, special immigrants from Iraq and Afghanistan. All of those folks have an immigration status that makes them eligible to become a lawful permanent resident. Not all statuses make you eligible to become a lawful permanent resident, though. Some examples of statuses that do not make people eligible for lawful permanent residency: withholding of removal, I mentioned that earlier, parolees, and TPS, temporary protected status. All of those statuses allow people to be here lawfully, to work, and they are protected from deportation, but they are not on a path to a green card, which means they are not on a path to U.S. citizenship. And as I also already mentioned, when you get your LPR status, you get a green card. So that's your proof that you have LPR status. Next slide, please. All right, so now that we've kind of laid the groundwork here for some basic immigration statuses, I'm going to go through the ways in which HR 1 cuts back on immigrant access to medical assistance, CHIP, and Penny. The good news on CHIP and medical assistance for kids, I'll give you the good news up front. HR 1 makes no changes at all to immigrant access for kids to medical assistance and CHIP. That's the good news. Next slide. All right, so I'm going to just do a brief overview of what the current rules are so you know how things are going to be changing under HR 1. Currently, under rules that have been in place, laws that have been in place for decades, these immigrants listed here on this slide and the next two slides can get medical assistance. So starting with humanitarian immigrants, this includes refugees, asylees, Cuban Haitian entrants, T visa holders, people with withholding of removal, special immigrants from Iraq or Afghanistan, and then certain groups of people who were paroled into the US from Afghanistan and Ukraine, from Afghanistan after the US military withdrawal there in July 2021, and from Ukraine after the Russian invasion in February 2022. Next slide. If you're not one of those humanitarian immigrants, you can still get medical assistance if you are qualified, if you are a qualified immigrant, and you meet either the criteria under either 2A or 2B on this slide. So qualified immigrants are lawful permanent residents, VAWA petitioners, and people who have been paroled into the US for at least 1 year. Those folks can get medical assistance if they've had that status for at least 5 years, or if they've had that status for less than 5 years, they can still get medical assistance if they are a child or pregnant, or if they got their green card because they were a humanitarian immigrant. So for example, if they were a refugee who got their green card because they were a refugee, then they can get medical assistance even if they're in their first 5 years with their green card. Next slide. Then finally, kids. Kids and pregnant people who are not humanitarian, they are not qualified, they can still get medical assistance as long as they are, quote, lawfully present. Lawfully present is a very broad term that includes almost everybody who's in the US with permission. It includes TPS, U visas, people who have pending asylum applications if they have work authorization, or children with pending asylum applications whose asylum applications have been pending at least 180 days. So a very broad group of kids and pregnant people who can get medical assistance. Next slide. And then finally, for CHIP, a very broad range of children can also get CHIP, just like a very broad range of children can get medical assistance. Humanitarian, qualified, and lawfully present kids can get CHIP. So that's pretty much any child who's in the US with permission, even if that permission is temporary. Next slide. So again, that really good news off the top, there are no changes under HR 1 for medical assistance or CHIP for kids, and there are no medical assistance changes for pregnant adults in terms of immigrant access. So a very broad range of kids and pregnant people can get medical assistance and CHIP today, and that will not change under HR 1. All of these people listed here on this green box can get these programs if they're a kid or they're pregnant adult now, and they will continue to be able to get these programs after HR 1 rules go into effect. Next slide. The bad news, the rules will change for non-pregnant adults starting in October 2026. So starting in October 2026, we're going to go from, on the left-hand slide, about 11 immigration statuses that make people eligible for medical assistance, and that's going to shrink down to just 3. So the only immigration statuses that will give people access, that will give non-pregnant adults access to medical assistance under HR 1 will be green card holders, Cuban Haitian entrants, COFA migrants. COFA migrants, I don't know, I don't think that we have a COFA migrant population in Pennsylvania. I might be wrong about that, so please let me know if I am. But I think these are primarily folks who live in Hawaii or along the west coast of continental US. So I think in Pennsylvania, it will really, for all practical purposes, just be people with green cards and Cuban Haitian entrants, and that's it after starting October 2026. Next slide. There are also changes happening to Penny, as Joanna mentioned. The first change will happen this January 2026, and that change will be that premium tax credits that are currently available to all lawfully present immigrants under 100% of the federal poverty line will end. Those folks under 100% of the federal poverty line will no longer be eligible for premium tax credits starting January 2026. So the first penny change in terms of immigrant access will target poor immigrants first. So right now, all of the immigration statuses in the green box on the left, all of those immigration statuses give people access to premium tax credits if they are under 100% of the federal poverty line. Starting in January, that will shrink to 0. Nobody under 100% of the federal poverty line will be eligible for premium tax credits. Next slide. The second change in terms of penny immigrant eligibility under HR 1 will start in January 2027. And that change will be a very similar change to the one we saw with medical assistance. The types of immigration statuses, the number of immigration statuses that will make people eligible for premium tax credits will shrink to just those 3, those same 3 that we saw before. So green card holders, Cuban Haitian entrants, COFA migrants. Everyone else, everybody, all those people you see listed in the green box on the left here, those are people who currently have access to premium tax credits if they are over 100% of the federal poverty line. That will shrink. That will shrink to just 3 starting January 2027, to just 3. So green card holders, Cuban Haitian entrants, COFA migrants will be the only groups of immigrants with access to premium tax credits starting in January 2027. Next slide. So I know that's a lot to go through within over about 10 minutes or so. So I made another table here in an attempt to sum up the bad news. In the blue box here on the left, I've listed the types of immigration statuses who will be cut off of medical assistance access starting October 2026. In the middle light orange box, I've listed the folks who will be cut off from premium tax credit eligibility if they are under 100% of the federal poverty line starting in January 2026. And then all the way on the right, in the darker orange, we have folks who will be losing premium tax credit eligibility if they're over 100% of the federal poverty line starting in January 2027. One thing I want to note here, there are a number of folks listed here who could potentially be eligible for green cards, right? So, you know, the number one group listed in the blue box on the left are refugees. Refugees will lose medical assistance access in October 2026, but only if they do not have a green card. And remember, refugees become eligible for a green card after they've been in the US with refugee status for 1 year. So keep that in mind, right? If you're working with somebody who can get a green card, or maybe they're about to get a green card, they should get that green card and they should make sure that the county assistance office knows that they have that green card so that they can potentially keep their access to health coverage when these rules go into effect. All right, next slide. Okay, couple things to keep in mind. For people who are going to lose their access to healthcare under HR 1 because of their immigration status, there are two potential options that HR 1 does not change, and that could give some of these people some access to health coverage after HR 1 rules go into effect. The first is general assistance medical assistance. This is a very small medical assistance program that's available to anyone who is lawfully present and who fits into certain types of categories of people. I've listed the categories here, starting with people age 59 plus, and who are very low income and meet very low asset tests. So this program can be very hard for a lot of people because the income limit is so low, but for people who will be losing either access to medical assistance under HR 1 or penny premium tax credits under HR 1, and who are very low income, this medical assistance program might be the answer for them and might allow them to maintain access to healthcare coverage. Next slide. The other potential program that could allow some of these folks to maintain access to healthcare coverage is emergency medical assistance. Emergency medical assistance is available to everyone who meets all medical assistance eligibility criteria except the immigration status criteria and who have an emergency medical condition. HR 1 did nothing to change EMA eligibility. EMA remains in the law as it has always been. HR 1 did, however, change the amount of money that the state will get in order to provide EMA coverage. So there is an EMA funding cut that we will be paying very close attention to over the next year plus. But for now, nothing about EMA eligibility or policy has changed. Next slide. I think I'm going to pass it back over to Joanna for a minute.
Yes, so I did mention some of these things already, but we know we went over a lot of information today. We have a lot of bad news, unfortunately, but there are some things that we can do, including sharing and collecting stories. It's really important, like I mentioned before, to share your experience about how penny coverage is important to you and how increased costs would impact you. The same goes for Medicaid. So if you are a Medicaid recipient or if you work with Medicaid recipients, it's very important to share your story about how Medicaid has worked for you. We also are really encouraging people to reach out to their members of Congress right now about the importance of extending these enhanced premium tax credits through penny. Like I mentioned, Congress is currently debating extending these tax credits. We have a real chance right now for Congress to extend them. And so the more people reach out, the better. And you can use this link to send a message directly. Additionally, FAN, CLS, PHLP, and others are part of a coalition working to reduce the harm of all of these changes on Pennsylvanians. If you're interested, if you're a partner organization interested in participating in that coalition, you can email bill@pahealthaccess.org. And then Additionally, you can sign up for PHLP's newsletter to receive updates about all of these changes. We do expect a lot will change, and we'll know a lot more information in the months to come. So please sign up for that newsletter to receive updates. And I think that's it on my end. We have some time for questions, I believe. A few minutes.
We do have a few minutes.
Yeah, we do. I mean, I did notice a lot of questions in the chat, and we tried to answer them around people with disabilities and the impact of these changes on people with disabilities. Just as a general matter, and I'll speak to the Medicaid side of this. For Medicaid, the work requirements apply to people, as I said earlier, who are on expansion Medicaid, and there are other categories of Medicaid that somebody with a disability might be on. They might be, if they're on, for example, supplemental security income or SSI, then they're getting Medicaid because of that. So they wouldn't be in an expansion category. If they're on a Medicaid waiver, that's not expansion. MAUD is not. Something called Healthy Horizons is our prime category for people over 65 or who have a disability. But there are some people with disabilities who are in the Medicaid expansion. And those folks, if that is those folks may be able to get an exemption. We are going to have to wait to get a more fleshed out definition of medically frail, this medically frail exemption, to see what that means and how, there might be some information in the rule that we're expecting next June or by next June that will explain how people can demonstrate that they have a disability that meets the requirements. And then I did see there were a number of questions in the chat that we're going to do our best to answer. We've done it. We've put some in for people to see. I will just want to remind everybody that we are going to be sharing this presentation as well as the recording. I'm trying to see. We did answer most of the major questions in the chat.
I think so. And if I can, I'll just say kind of out loud, there were a lot of questions that I think reflect the anxiety that we're all feeling about how uncertain the future here is. I mean, the funding cuts are very big, and we simply don't know how that is going to play out over the next year plus. But and so there were some questions about that we can't answer yet, but we will definitely be paying very close attention to that as time goes on, and we'll be providing updates as we know more.
Okay. So next slide, please. Final slide, I think.
Oh, yeah.
So actually we do have some resources that you will get the slides. We have a bunch of resources that are linked in there for additional information on HR1. And as Joanna said, you can get updates if you join the Medicaid Marketplace Coalition, as well as PHLP's newsletter. I think people are asking if we're going to have a copy of the Q&A transcript. We will summarize some of the answers when we send out the slides. And next slide. Finally, I know we already answered questions in the chat. We are hoping to be doing additional work, providing updates. We want to make sure everyone's kept informed. This is really our first opportunity to summarize what's going on with HR1. There are other webinars that we will plan for the future, and are happy to answer technical assistance questions people have. If we weren't able to answer your questions in the chat, we may be able to answer some of them offline. But in the meantime, I know this is challenging material to digest. We're really glad you were here with us, and please take a look at that action slide that Joanna went over, and we'll take it from there. Thank you, everybody.
Thank you.
Thanks all.